Hello everyone. The topic of discussion today is the hair and its anatomy. Now, hair is a very important topic with respect to the pre-PG exams. We get a lot of questions from the anatomy of the hair and subsequently also from the alopecias or the hair disorders. So let us discuss each of them in detail. How is the normal hair look like? What are the different type of hairs, hair cycle, and different type of hair disorders? Starting with the hair anatomy. And first of all, we will discuss the horizontal section of the hair. So what is the horizontal section of the hair? In horizontal section, hair is made up of multiple layers. And in your exam, you may need to know which is the innermost layer followed by the outermost layers. The innermost layer in the horizontal section is medulla. Second to this, we have cortex. And surrounding this, we have medulla, we have cortex, and we have cuticle. These are the three layers from inner to outer. There are few more layers. The layer which is present just outside the cuticle is inner root sheath, which is sometimes also known as IRS. Inner root sheath, which is also known as IRS. Outside inner root sheath, you have outer root sheath, which is known as ORS. And outside the outer root sheath, the outermost layer is dermal sheath. So the hair which looks so thin, so insignificant, it is actually made up of so many layers. And we all need to know this sequence because sometimes we get a sequence based question. So the innermost is medulla, then we have cortex, then we have cuticle, inner root sheath, outer root sheath, and then comes the dermal sheath. In few cases, the inner root sheath is further divided into three layers. From inside to outside, we have three layers of the inner root sheath. Inner root sheath cuticle, inner root sheath cuticle. Then we have Huxley layer, and then we have Henle layer. So inner root sheath cuticle, Huxley and Henle layer, these are the different layers which constitute the inner root sheath. In your exam, they can also ask you which is the outermost layer of the inner root sheath. So remember, it is the Henle layer. Which is the innermost layer of inner root sheath? It is the inner root sheath cuticle. So like that, you can get the questions from the horizontal section of the hair. We do get one question which is very popular, and that is the medullary index. Very important when you will be reading forensic medicines. So sometimes at the crime scene, you get a hair, and it is our duty to find out whether it is a human hair or it is an animal hair. So for that, we will look for the medullary index. What is a medullary index? It is a ratio of medulla is to cortex. It is the ratio of medulla is to cortex in humans. It is 1 is to 3. So cortex is 3 times that of medulla. But in animals, it is 1 is to 2. The cortex is twice as large as medulla. So this is a very simple test to find out how is the hair whether it is a human hair or it is an animal hair, and it is very useful when we are doing a crime scene investigation. So horizontal section of the hair, different layers starting from innermost medulla, cortex, cuticle, inner root sheath, outer root sheath, and dermal sheath. Now let us discuss the vertical section. Let us discuss the vertical section of the hair. Vertical section is important because there are few landmarks which you need to know. So this is your skin section. There's a pocket-like invagination in which the hair is present. This is known as hair follicle. This is your dermoepidermal junction, epidermis, dermis, and this is the. So we have epidermis, we have dermis, and we have hypodermis. Epidermis, dermis, and we have hypodermis. Now the epidermis, what is the characteristic feature here is, in epidermis, the hair follicle passes throughout, and in the dermis, it reaches up to the hair, and the lower part is made up of subcutaneous tissue. So here, the whole length, it reaches up to the subcutaneous tissue. This is your hair. At the lower part of the hair, there is a slight invagination. At the lower part of the hair, there is a slight invagination like this. And this is actually known as hair papilla. This is actually known as hair papilla. A small invagination which is present at the lower end, this is known as hair papilla. What is the function of the hair papilla? Hair papilla, the important function is, it helps in the nutrient supply of the hair. Whatever nutrition, blood, whatever it is given to the hair, it is through this lower part which is known as hair papilla. Now there is a very specialized structure which is present like this. This is the a very specialized structure which is present like this. And what is this? This is known as a rector pili muscle. This muscle divides the hair into two parts. The upper part is known as upper segment and the lower part is known as lower segment. So upper part by the upper segment and the lower part is by the lower segment. So if they ask you in exam that which part divide the hairs into upper and the lower segment, please remember it is the attachment of the erector pili muscle which divide the hair into two parts. Attachment of the erector pili muscle which divides the hair into two parts, that is the above part which is the upper segment and the lower part which is the lower segment. We have one more structure which opens into the hair. This is the sebaceous gland. And the opening of the sebaceous gland duct divides the hair into upper infundibulum and lower isthmus. We have upper infundibulum and lower isthmus, which is the part divided or made by the opening of the sebaceous gland duct. It is the part which is made by the opening of sebaceous gland duct. Is this point clear? So we have a vertical section, we have a horizontal section. In vertical section, they will ask you different parts of the hair. The part which is divided by erecta pili muscle is the upper segment and the lower segment. And the part which is divided by the sebaceous duct opening, it is infundibulum and it is isthmus. Infundibulum and isthmus. Moving to the next part. Different type of the hairs. Different type of hair. Please remember we have three type of hairs with us. We have three types of hair. Lanugo, vellus and terminal. We have three type of hair, lanugo hair, vellus hair and terminal hair. What is the difference between these three types? Lanugo, vellus or terminal. What is the difference between these three types? Lanugo hair, they are the fetal hair. When the baby is present inside the uterus, it has fine non-pigmented hairs over it, and that is known as lanugo hair. What are its property? They are non-pigmented, and in addition to that, they are non-medulated. In your exam, you can get a question. What are the characteristic feature of vellus hair, terminal hair or lanugo hair? So you should know all these features. Once the baby is born, the lanugo hairs will shed off. After birth, they will not have any hairs on their body. The lanugo hairs are all gone. The hairs which you see after birth, they are of two types. One is vellus and another is terminal. Vellus hair are the fine, thin, non-pigmented hair present all over the body except for the scalp since birth and except for the axilla, areola, groin and beard area after puberty. Because all these areas, they possess thick, coarse, pigmented, medulated hair which is known as terminal hair. Now, what are the characteristic features we discussed? Vellus hair, they are short, they are fine, they are non-medulated, short, fine, non-medulated, and they are non-pigmented also. They are present throughout the body, like on the scalp, on the face. But in the scalp, along with vellus, the majority component is on the terminal part. Rest part of the body, the majority component is with the vellus part. The terminal hair, they are dark, they are coarse, they are medulated, and please remember they are pigmented. They are dark, coarse, medulated, and they are pigmented. If you have to draw them, what is the difference? If you have to draw them, what is the difference? Please remember the difference between a lanugo, vellus, and terminal is something like this. This is your skin. The vellus hair is a short hair which only extend up to the mid-dermis. But the terminal hair are long, which extend up to the subcutis. They extend up to the subcutis. So that is the difference. They are thin also. Vellus hair are thin because they don't have medulla in them. They are thin because they don't have medulla in them compared to that of terminal hair which is thick, which is comparatively thicker because they have thick medulla which is present in proportion of 1:3 with that of cortex. So you have thick medulla which is present like this. So that is the difference between a terminal hair and the vellus hair. And we have already discussed that the vellus hair, they are present throughout the body except for the scalp, except for the areola, axilla, groin after puberty, because in these areas the vellus hair they converts into the terminal hair under the influence of androgen, under the influence of androgens. Now there is another very important part, and that is the hair cycle. What are the different part of the hair cycle? You do get a lot of questions out of it. Now, like your life cycle, like every human being has a particular cycle, right? They are born, then they grow, they get old, and they die. And please remember, the birth and the death, they are in proportion to each other. On an average, the person dying, the same average individuals, they are born. So the proportion is uniform throughout. Same thing. On the scalp, few hairs, they are in their growth phase. They are growing, becoming more and more tall. And there are few hairs which are in their deteriorating phase, which are having degeneration and they are about to fall. This is known as a hair cycle. The hairs are in their different proportions. To describe the hair cycle, you should know that we have three phases of hair cycle. Anagen, which moves into catagen, which moves into telogen. And after telogen, again the hair enters into the anagen phase. So let us discuss this little bit more in detail about the hair cycle. The first phase, which is the growth phase, is the anagen phase. It is considered to be the growth phase. And there was once a question asked that which phase determined the total length of the hair. Please remember, the phase which determines the total length of the hair is the anagen phase. The duration of anagen phase is around 2 to 5 years, but on an average, we will consider this to be 3 years. It is easy for us to remember. And please remember, total 80% of the hairs on the scalp are in the anagen phase at one point of time. Once the anagen phase is completed, the hair will automatically go into the next phase of catagen. The hair will automatically move from anagen to catagen. Catagen is a catabolic phase, where the subsequent changes which is required for hair fall, it starts and it finishes. It is around 3 weeks. The duration of the catagen is around 3 weeks. And total 5%, around 5% of the hair at one point of time in their catagen phase. Once the catabolic changes have occurred, hair will automatically enter into the next stage, which is known as telogen phase. Telogen phase is a resting phase. It is a resting phase. It means that the hair is still present. It has not fallen. It is still present and it is simply resting on the hair follicle. No catabolic process are occurring. They are simply present inside the hair follicle, resting, and this phase goes for around 3 months. And around 15% of the total hairs are in the telogen phase at one point of time. Once the telogen is complete, there will be shedding of the hair and the empty hair follicle which is present, it enters into the telogen phase. So anagen, catagen, telogen, the sequence keep on occurring. Let us look with the help of an image. In anagen, you see long hair because it is the growth phase. The lower part of the hair, it reaches up to the subcutis. So that is how anagen hair, very smart tall hairs. This is how anagen hair look like. Once the anagen is complete, the hair enter into the second phase, which is known as catagen phase. In catagen phase, you will observe that there are some changes which have already started to occur at the lower part of the hair, and this can be seen by blurring at the lower end. Once the catagen is done, we will see that the hair becomes very small, but they are still attached to the hair follicle. The hair have become short, but they are still attached, and these shorter hairs are known as club hair. After shedding, once the hairs are headed, when the hairs are shedded, the empty hair follicles are left. These empty hair follicles will now enter into the anagen phase. You call shedded hair as an exogen hair, and you call empty hair follicle as kenogen. So that is the whole duration, the anagen, the catagen, and telogen. And the phase will keep on occurring. Anagen, catagen, telogen. There will be hair shedding also. Is this point clear to all of you? Is this point clear to all my dear students? Can I get a thumbs up from you? Very nice. So that is about the hair cycle. Few points which we all need to know with respect to hair cycle is all the hairs have asynchronous growth. All the hairs have asynchronous growth. What do you mean by asynchronous? Asynchronous means the adjacent hair, they are in a different phase of the hair cycle. And why they should be a asynchronous growth? Because just imagine if all the hairs are growing in the same phase. Everyone has anagen, then suddenly everyone will go into catagen and telogen, and after one point of time, all the hairs will start to fall. So to prevent that, we have the hairs in different stages of the hair cycle, and this is known as the asynchronous growth. This is known as the asynchronous growth of the hair cycle. In few conditions, for example, acute illnesses like COVID infection, it can be typhoid, it can be malaria. Following these infections, there is premature termination of anagen, because obviously when the body is sick, you need more energy to cope up with that infective stage. So body will divert all the nutrition to the part where it is required the most, and it will divert the blood supply of the hair, and that is why the hair growth is limited. The only phase where you see the growth is the anagen phase. So in the acute infective stages, the anagen phase get arrested very fast, and then it enters into a catagen phase or a telogen phase. Now at the attachment of below the attachment of the erector pili muscle, so we have discussed that this is the hair, the vertical section of the hair. There is attachment of a muscle which is known as erector pili muscle. Just below the attachment, somewhere here, you have collection of stem cells, and these are known as Adamson's fringe. If you have any damage to this part, you will see permanent loss of hair. For example, specifically in the inflammatory type of hair loss, fungal infections, bacterial infections, some conditions like BLE, lichen planus. In inflammatory type of hair loss, due to inflammation, the Adamson's fringe get affected. And when the Adamson's fringe get affected, the patient start developing the scarring type of hair loss. So when this is damaged, you will see irreversible type of hair loss. But if it is intact, you will have reversible type of hair loss. You will have reversible type of hair loss. One more feature which we have to discuss. We have discussed that at the lower part of the hair, if this is your hair, there is a invagination like this in the lower part of the hair. So at the lower part, just below the attachment of the erector pili muscle, this part is the lower segment, which is also known as hair bulb. It was below the attachment of the erector pili muscle. At this part, we have the invagination, which is known as hair papilla. Through the hair papilla, the blood vessels enter inside and supply the nutrition. You also have pigmented cells which are present like this, which give color to the hair. If you have any damage to this part of the hair, the blood supply is gone, the pigmentary cell is gone. So ultimately you will see depigmented white hairs which will fall soon, because that was the part which was supplying the color and the nutrition to the hair. And when we need a growth phase or when we need a growing hair, you need to have a very good supply of blood and nutrition. You will be reading about a disease which is known as androgenic alopecia. In androgenic alopecia, we give a drug which is known as minoxidil. Please remember, minoxidil work on these blood vessels. It causes vasodilatation of these blood vessels, increasing its blood supply. And when the blood supply increases, there is improvement in the hair growth. So that is all about the anatomy of the hair.